Hello everyone. Today we are going to discuss about the most heated topic, that is District Residency Program for MS and MD PGs that is being recently introduced by Government of India. So let's see whether it is a boon or bane for these PGs. The Government of India presented this notification during first COVID wave, that is in September 2020, that a compulsory 3-month posting is must in district hospital and district health system for all MS and MD pursuing students. And this should be implemented with immediate effect for both private and government medical college students, including deemed university students. Because this could never be implemented due to two back-to-back COVID waves. But now, recently, it has been started to get implemented from April 2023. So what are the objectives of today's talk are, so what is this district residency program, why it has been started, and from which batch of student it is being applied, and what are the responsibilities of PGs and the state government in this DRP. And I have done a brief SWOT analysis of this district residency program and what can be the future ahead, and how is the response of residents and consultants about this newly implemented program. So this is the amendment that has been published by Board of Governors in supersession of Medical Council of India. And they have amended in the Postgraduate Medical Education Regulations 2000 in clause 30 under the heading of training program. So this has been started with two essential principles of postgraduate medical training. That is, the learning experiences have to be derived from and targeted to the needs of community. And the doctors have to be trained in diverse settings, including those which are close to the community. And as we all know, district health system, including the district hospitals, are most closest to the public healthcare enterprise. And it is these district hospitals that represent multi-speciality facilities providing comprehensive secondary level care. And they are closest to the community than most of your medical college hospitals. And they are the facilities that serve majority of the health needs of the people in the country. So what the main objectives are to expose the postgraduate student to this district health system and involve them in all the healthcare services that are provided at such places with the main motto of learning while serving. And they have to be acquainted with the planning, implementation, and monitoring and assessment of national health programs at the district level. And they have to get oriented to promotive, preventive, and curative and rehabilitative services, along with the professionals who are serving in the National Health Mission. In doing so, a postgraduate medical student would also be contributing towards strengthening of these services at the district health system, and they are working as a specialty residents along with the members of district teams. So it is being applied from all the students who have taken admission from 2021 onwards. So you will be posted in your third, fourth, or fifth semester in a district hospital or a district health system. So there are two terminologies, that is a district hospital and a district health system. District hospital is a functional public sector or a government funded hospital of not less than 100-bed facility and with the designated specialties at that level. And district health system consists of CHCs, PHCs, urban health center, sub-health center, as well as community outreach center. So whenever a postgraduate student is posted there, he will be called as a district resident. So there are separate clinical responsibilities for clinical specialty postgraduate and a pre and paraclinical specialty postgraduates. So a clinical specialty postgraduate will be posted in his own specialty or an aligned specialty, and he will be asked to do inpatient duties, outpatient duties, casualty, and other areas. And also he should encompass and cover the night duties as well. A para and preclinical subspecialties like anatomy, physiology, biochemistry, community medicine, forensic medicine, microbiology, pathology, physiology, and pharmacology PGs, they would be trained in to contribute to diagnostic and laboratory services, pharmacy services, forensic services, and general clinical duties. And also they are requested to take up the managerial roles and also to involve in public health programs. They can also be posted in research units or facilities or field sites of ICMR and other national research organizations. The leaves and stipends you will be drawing as per your parent medical college. So when you are training under the district residency program, it is required to maintain a logbook and to enter all the procedures and the cases and day-to-day activities you do in your district residency program. You will be required to provide attendance either in the digital form or in a manual form in the attendance register at your workplace. And you will simultaneously expected to participate in the parent college academics through a remote platform like Zoom or in a Google Meet in all the case discussions, seminars, journal clubs, or thesis discussion that occur at your parent medical college. And like your thesis presentation, DRP is a must for being eligible for final PG examination. So do not forget to take the completion certificate from a district residency program coordinator after your completion. And each medical college will set up a committee under the academic cell to coordinate and monitor the implementation of district residency program. So the good news about this district residency program is the parent medical college or institute, they may apply for enhancement of postgraduate seats to the boarding governors of Medical Council of India to compensate for potential compromise of work at the teaching hospital or institute due to this outposting of postgraduate medicine residents. So such applications can be made directly to the Board of Governors in supersession of Medical Council of India after 1 year of implementation of this program, that is from the second year of implementation. So because of this enhancement, approximately more than 4,000 to 6,000 PG seats will be getting added up, and that will be a biggest advantage to PG preparing post-MBBS students. And government, after learning the responsibilities of postgraduate students, let's see what is the responsibility of state government or union territories. The state government or union territory, they will appoint a state or union territory nodal officer who will identify the designated hospitals, and he will prepare the roster for the PGs 6 months in advance for the posting. And the official will also be responsible for any grievances at the state level. And the state governments will also be responsible to provide the suitable accommodation and transportation to the workplace if the living quarters is far away. And they also should provide adequate security, especially for lady residents. And all the time, these district residents shall remain under the jurisdiction of these district residency program nodal officer. Especially, I think the most probably district health officer will serve as a district residency program nodal officers. So there are two special categories in this DRP program. For example, if all the PGs of a state or a union territory, they cannot be absorbed into their respective state or union territory, there is a possibility that with mutual understanding of the neighboring state governments, in coordination with National Coordination Cell, they can be posted to a neighboring state or union territory. And special clause for Northeastern state students is because there are scanty medical college institutes in Northeastern zone, any postgraduate students from these Northeastern zone and studying at various medical college institutions across the country, they can get posted in their own hometown states in this district residency program so that they will strengthen the district health system in their respective home states. This facility is only for Northeastern state students. And the state government or union territory governments can also consider providing additional honorarium to these district residents as a token of recognition for their contribution. If any postgraduate student volunteers to serve in a hilly areas or remote and difficult areas, they may be given additional incentives. And the district residency program coordinator is the competent authority to sanction any additional leave during this program. So it is a well-established hierarchical system. The state level district residency program nodal officer will in turn report to state or union territory level steering committee, who in turn will report to national level steering committee. And the highest body is the National Coordination Cell, which monitors the smooth implementation of the system. So a brief SWOT analysis I try to club. I try to borrow this information from many of the published articles which are discusses about the positives and negatives. And also I have added some of my own opinions. The main strength of this program is it will match to its motto of learning while serving. And you're learning from the places which are closest to the community where you get cases to your referral hospitals. And it solves the perennial shortage of doctors in these peripheral sector. And it will mainly address the shortage of human resources in the Ministry of Health and Family Welfare. And the weaknesses are there is poor infrastructure in many of the district hospital, but not so after this COVID pandemic. The district hospital infrastructure have markedly improved with many new facilities and equipments that have been installed. Though we all know that there is less academic learning in these peripheral hospitals, you will be asked to remotely join your parent institute. There may be no proper lodging or food facilities, and surgical branches, students, they may miss some of the important postings and also cutting chances. And it gives a good opportunity to spend time and read any backlog topics during this time. And it may be a good relaxation from your busy schedule at your medical college. And you may also complete your thesis part like literature review methodology. And to do all this, you need a smart approach, or else you will end up wasting this 3 months of potential time. Absolutely, there are no threats except for missing academic activities. There may be initial hiccups until everything falls in place after 2 to 3 batches. Initial 2 to 3 batches may struggle because of poor execution of this new program. In the future ahead of this program, there is no escape from this district residency program as it is embedded into the National Medical Council Postgraduate Medical Education Regulations. And because after this Gazette notification, and not all district hospitals are threat to learning. They may be boon to this private or deemed university students without much patient load in their parent college. And if proper enhancement is applied by the parent institute, there may be enormous increase in postgraduate seats, approximately to the tune of 4,000 to 6,000 seats per year. And if postgraduate students from other state medical colleges are also allowed to get posted in their hometown districts, it will also guide them to plan for future endeavors after they finish PG. And if this DRP properly works, it can cut down the problem of quacks at the periphery levels, and it will improve the healthcare system definitely. As I already discussed, there may be some glitches to the surgical branch students. And after implementation, there have been number of articles that are published in various newspapers. There have been some protests by the residents of Telangana to requesting their posting to be done in their hometown districts. But currently, the provision is only for the Northeastern state students. After addressing this problem. They may come up in the subsequent years. It may be all the other state students may get posted in their hometown districts. We just have to wait and see how the government takes these suggestions. There are some unanswered questions like for in-service candidates who are already coming from the district health systems, whether they should do these 3 months of outpostings or not. And especially post-diploma students, they have only 2 years of post-graduation course. Whether they have to be posted in their first year of post-graduation course only is still not clear. And why primary DNB or diploma students are left out of this learning while serving objective is not clear yet. And if the state government announces additional incentives, travel and accommodation allowance, it will solve the initial glitches. And if the government responds to the comments and the suggestions by the residents and the consultants, it will be apt that this program will be a grand success. Overall, it's a big thumbs up for this smart draft from the government. It will definitely help to strengthen the healthcare system of the country. There may be initial glitches which may hurt the postgraduates, and after a few batches, everything will fall in place for the subsequent batches. I hope you like the information about this. If you like the information, please press the like button and also subscribe to my channel. And I will also share the Gazette notification and also the amendment in the postgraduate medical education regulations in the comment section. Thank you, one and all.